Because a mother needs to be sure.
Because their immune systems are still developing, babies and toddlers are more susceptible to colds and flu. Many parents like Anik look to experts like Sister Lilian for advice on how to treat these conditions in infants.
What I would like to know is how will I know if my baby is starting to get a cold or either the flu?
Often the mom's instinct tells her the previous day already something's not quite right. She just knows it. But then one of the basic signs and symptoms is blocked nose or runny nose. And the baby often then has a disturbed sleep pattern and may well go off their food, just because that blocked congestion makes it quite difficult to feed. And if the baby gets a bit more seriously sick, you might notice a cough from the mucus dripping down the back of the throat. And also, if it goes even deeper, usually the child will get a fever.
I've heard that prevention is better than cure. Do you have any tips regarding how I can prevent her from getting the flu?
Prevention is definitely better than cure, and there's actually a lot that one can do. One needs to understand that being ill is not a mistake in itself. That's how we build our immunity. So one doesn't always have to do something immediately. However, when you can see your little one is really poorly, then it's a good idea to revert to basics. One of the first basics is check the diet, because when a lot of mucus is made, bacteria and viruses can grow in that, and that often leads to a full-blown infection.
Contrary to popular belief, baby's milk doesn't cause excess mucus, and it's advisable to keep providing your baby with breast milk or fortified infant formula.
If you live in a cold, dry climate in winter, that might make your little one a bit more susceptible. But that doesn't mean fresh air and sunshine isn't essential. It is. However, you need to dress your child appropriately, especially if they're under a year. Put on a cap, covers those ears when you take them for a walk or go play outside.
Although coughs are a symptom and not a disease in itself, not all coughing is considered serious. Interpreting the cough correctly is important when choosing how to treat it.
When Annabelle was around 6 months of age, she experienced a cough. And what advice do you have for us when they were experiencing a cough?
One always worries more when there's a cough and not just a blocked or a runny nose. But not all coughs are serious. It's usually because there's mucus running down the back of the throat from this excess mucus. And so if you use the exact same tips that I've given for excess mucus and possibly use some natural remedies, that can go a long way to stopping that, and it doesn't get as far or as involved as a cough. Some coughs are loose coughs and you'll hear a lot of gurgling mucus, and others are dry coughs. The dry coughs are usually when the weather is cold and it's a dry climate that you live in, and they often are a little bit more serious. However, it's about first treating on that minor level, and then if you see that your baby's getting worse, making sure that you do something about it. It's very often helpful to use a bit of eucalyptus oil, which you can put a few drops under the hot tap when you're running baby's bath, or you can use a humidifier, and that keeps the chest nice and open at night.
With a healthy diet, warm clothing, and some love from mom, you and your baby will be just fine when cold and flu strike. If your little one doesn't improve soon with self-help tips, or the cough develops into something more serious, see your doctor as soon as possible.
Because a mother needs to be sure.